I'm Averie.
And I'm Mel.
This is the Veda Lounge Podcast.
All things Vedic, cosmic, and magic.
For yoga teachers, entrepreneurs, creatives, and coming back to your own center.
We explore themes on living like you practice to knowing your nature.
Join the conversation for an embodied homecoming to illuminate your radiance.
Through getting nerdy with Vedic sciences and self-discovery, cozy into your cosmic cadence. All right. Welcome back to the Veda Lounge Podcast. It's Mel here.
And Averie, hello.
We are so excited to host Alice Blizman today on the podcast, and just a little bit about her. She's a mother, military spouse, military veteran, and physician board certified in family medicine and lifestyle medicine. I had the privilege of meeting Alice through the yoga teacher training, our 200 hour, and she is a yoga teacher and is passionate about empowering others to incorporate yoga and mind-body medicine into their daily lives. Alice, welcome. We're so excited to have you.
Thank you so much. I'm so excited to be here. Thank you for inviting me.
I would love for you to share a little bit about your background and your journey from getting into medicine to how that led you to pursue yoga.
Sure, yes. So I think I decided to go into medicine when I was pretty young, probably in my early teens. Before college, I knew I wanted to go into medicine. Um, I eventually joined the military, the Navy, and became a physician in the Navy. That probably started in college where I had ideas. I got a brochure in the mail about becoming a flight surgeon, and I looked at it. It looked really cool and exciting and adventurous. So that's how I became to, coming to the decision and joining the military. And I loved it. I first completed medical school and then became an active duty physician doing internship at a naval hospital. And then from there, the 4 years after that, I worked as what they call a general medical officer, where I'm kind of an independent primary care provider for an active duty, unit, a battalion of Marines for a year, and then I also worked in an urgent care center for a couple years as well. So varying experiences in that role, and I really enjoyed it. During that time, I think probably when I was working with the Marines, I was introduced to yoga. I started going to yoga classes and incorporating yoga into like a routine PT with the other, my fellow sailors in the mornings before clinic time, and everybody absolutely loved it. And that was a transformative experience for me. Since then, I've been practicing yoga regularly, and I became a mother. I had 2 children, and then after that, after my second child, I made the decision to get out of the military just because at that time my husband it was also active duty, and the the stress of motherhood and being, dual military, couple was just a little bit too hard, especially in different branches. So I got out of the Navy and I applied for family medicine residency on the civilian side and completed that. But during that time was also when the COVID pandemic started during residency. It was a very stressful period in general because I was also geographically separated from my husband, who is an active duty Army physician, also deployed that time. And then the COVID pandemic, then having 2 young children was a very stressful period of time. So I think at that point, when I finished residency, going through that hard time, I committed to taking the time to do the yoga teacher training. Mostly, I think my own curiosity to kind of go on this spiritual journey and like better my mental health and physical health, as well as a tool to hopefully be able to bring to patients in the future, to educate patients and empower patients, because I feel like in medical school and even during residency training, I didn't get a whole lot of training or experience in counseling patients in regard to stress management, things like that. And during the COVID pandemic, during residency, we've encountered a lot of that. A lot of patients were coming to me asking what they can do to feel better. I felt a little kind of ashamed of myself that I didn't really know the true answers to how to better educate or empower patients. So the yoga teacher training was definitely helpful for that. Now that, since I've done that, I've looked into being certified in lifestyle medicine. Um, and I'll briefly explain what lifestyle medicine is first, because this was something that I was not aware of during my initial medical training. But lifestyle medicine is a medical specialty that basically uses or focuses on therapeutic lifestyle changes as the primary modality in treating chronic diseases, including mental health issues like depression, anxiety, as well as cardiovascular diseases, metabolic diseases such as obesity, diabetes, a lot of the chronic ailments of us, that's plaguing us Americans right now. So it doesn't necessarily, it has many similarities with, functional medicine, mind body medicine, integrative medicine, in that we're trying to treat the whole person and trying to find what the root cause of the diseases are, but also, applies evidence-based medicine, and it focuses on basically 6 pillars of lifestyle aspects, which include your diet, your physical activity, focuses on your sleep, your stress management, as well as positive social connections, as well as avoidance of risky substances, including alcohol, tobacco, and other substances as well. So clinicians in this field basically provides a whole person prescriptive lifestyle change based on these pillars. I also love that in lifestyle medicine, the clinicians are both medical experts, but also coaches for the patient. So, our role is not to just give a prescription, but also to empower and motivate patients to make lifestyle changes. And you create a long-term relationship with these patients too, because this is like a chronic, it's a long-term treatment. It's not like a one thing fixes, something quickly. It's a gradual change in lifestyle, and also teaches self-care and self-management techniques for patients as well. So I think, once I certified in lifestyle medicine and done the yoga teacher training, I saw a lot of similarities in between, yoga and lifestyle medicine. So, my passion is to incorporate both yoga and lifestyle medicine to help empower patients.
So beautiful. I mean, my goodness, immediately the question, and Averie, I don't know if this came up potentially for you, is like with the bridging, right? Because it's exciting to see medicine starting to embrace a lot more of that holistic framework, but also the way it can connect into these ancient concepts in a way, right? I would love to hear what you perceive as the like big things you saw in yoga, that it's like that's what they say in lifestyle medicine, but they say it this way. I don't know if there's any examples.
Yeah, I think one of the biggest things I learned from you, Melissa, in yoga teacher training is like how important the role of like self-agency is, right? So you make your yoga practice however you want it to be. And basically what your yoga practice is on the mat becomes, your yoga practice off the mat during the day, how you bring yoga into your lifestyle. So in lifestyle medicine, I've also learned like how important it is to empower patients that we ourselves have this innate ability to heal. So really empowering that, it's all, we have a responsibility and we have the power to, be the catalyst of healing.
I mean, I love when you mention building a relationship, right, with patients and getting to be sort of a coach and somebody who walks alongside them along their health journey. And I don't know if you've noticed a difference since stepping into lifestyle medicine that really makes a difference in the care that you're able to give and also the receptivity probably from patients. I think sometimes in, our modern go to the emergency room, go to the urgent care, it's very like check it off, and we're missing that, and people are leaving the system and they're feeling a lot more discouraged than they probably were walking in. And so have you noticed a difference in receptivity from patients in moving and switching more into lifestyle medicine?
Yes, definitely. I feel like being trained in family medicine, we've always, that's our goal, is, to build long-term relationships with
Right.
patients in general. But in lifestyle medicine, I've learned tools and techniques in motivational interviewing. So talking to patients in a way to empower them and to make their own, choices within their healthcare. That was very life changing, and I've definitely seen positive effects from patients and much more gratitude from patients as well. And I feel like my relationships with patients, now that they understand our role to foster their personal growth, I feel like it's just a much more effective relationship. Part of the method we use is goal setting with patients as well. But first, we have to kind of assess the patient's readiness for setting a specific goal. And when we do set goals, we try to make it a little more specific so they can act upon it. But we want to make sure they're motivated to make that change, in which we have to kind of dig in and ask, what's most important to you right now in terms of your health? What kind of changes do you want to see, and what would do you see as the outcome? So we do talk about setting goals, what we call SMART goals, which stands for specific, something that's measurable and achievable and relevant to the patient, and then something that is time bound as well. So that, at the next time we meet the patient, we can talk about what kind of positive changes came from that.
It's so interesting. I saw something recently on adherence about if a patient expresses what they want to see, like a lot of things are very much the provider saying, this is what to do, this is what the outcomes are. But when the patient actually voices and says, this is what I want to see, this is my goals, this is what I want, that their adherence goes up way more than just being told what to do. So, the participatory relationship that lifestyle medicine really offers patients, it makes so much sense that we move in that direction.
Absolutely. And there's really a rapidly growing body of evidence that shows how coaching really does help in changing health behaviors and producing positive health outcomes.
Well, it's interesting as you're speaking on this. I mean, for me, I'm putting together this really big bridge of therapeutic yoga is very person-centered, and lifestyle medicine, right, seems to be very patient-centered. And so it really makes sense that these two things have come together for you almost in a way that just makes sense and have kind of flowed into this beautiful, practice where you really get to be there with and not just, be okay here. It's like the same thing. Our greatest yoga teachers are the ones who sit with us, right? And really allow us to flourish as students. So it's so interesting to hear that really lifestyle medicine does mimic and model that.
Yes, and I feel like yoga I think when I first started yoga, just like everybody else, I was just thinking of yoga as, beautiful postures. But especially after doing the teacher training, we know now that yoga is a lifestyle. So, definitely infusing, things I've learned in the teacher training into patient plans is it's been very helpful. For example, yoga off the mat, doing breathing exercises in times of stress, that can be done at any time during the day, or specific relaxation techniques before bedtime, things like that. It's definitely a big part of lifestyle medicine as well.
Well, it's interesting because IYT, right, the Yoga Therapy Association, they do so much to try to move yoga into healthcare. And obviously, we are passionate about bringing access to yoga for all different types of populations. But I think one thing that people often forget, just in public health or population health in general, is that when they look at yoga, oftentimes it comes through this language that almost feels really esoteric or out there. But we have to remember that yogic literature, when we're pulling from the Vedic texts or we're pulling from these concepts, they're expressing it with a cultural tone, right? In the way that they understand. Example being subtle anatomy and how like the neuroendocrine system can work together. Well, they called that the chakras. So we're all talking about the same things in a way. However, there's that cultural influence and that yogic I call it literature, with being able to bridge it into modern health. I think that's one of the most important things that as yoga teachers or bringing in these mind-body modalities, lifestyle medicine and so forth, how we can collect from the wisdom, but we got to be able to translate it so people can understand what we're talking about, right?
No, I agree because I feel like medicine is so scientific based. And when people think of yoga, they think of, oh, it's like this religious, spiritual, path. And we don't talk enough about spirituality in medicine, in my opinion, and we should. But I think it's helpful, there's definitely been a lot of studies that's been done, right? So to make it more scientific, analyzing, the effects of the brain when we do mindfulness based relaxation techniques and things like that, I think it's definitely helpful for people to understand yoga as, as a huge benefit to the medical world.
Well, like with spirituality, being able to measure the biological benefits or the biochemical benefits that come from these practices. And obviously with the work I do with the military, translating into their language is something that we commonly try to do and help position things. So it's been fun to witness how they're talking about mindfulness or meditation or spiritual health, but making it in a way that is really either familiar to the personnel receiving it. Because if you just go in and say, okay, we're going to do pranayama practices or, connecting with our higher self, right? People are immediately like, what? So, but rather if we are listening to that, once you start talking about vagal tone and the vagus nerve and down regulation, people are more open to having the conversations. And I feel like as medicine is moving in these directions, the advocacy of bringing in yoga as adjunct care, and I don't know if it's going to be called yoga necessarily because of the religious connotation that is very hard to socialize people out of, or like assuming it's religious when obviously it's more of a system, it's a technology for wellness. But I think that's a huge access barrier, but rather how bringing these different concepts and principles, it's almost like mental health, right? Mental health is informed by, you have Carl Jung, you have Freud, you have all these different things that are infused into the treatment plans, and how yoga can be something that is really threaded into the treatment plan, whether you call it mindful mobility or stress reduction, right?
Yes, I totally agree. Yoga can be called in so many different ways. mind body medicine, yeah, mindful, mind body and soul connection, stress reduction, as you mentioned. And I love how the military is incorporating it, and yoga being normalized in different types of settings within our culture as well. Even within the Veterans Association as well, there are programs where lifestyle medicine, programs called Whole Health, where they incorporate the lifestyle medicine techniques with the veterans as well. So yeah, I love all of the changes that are coming.
It's an exciting time for sure. I feel like there's such an evolution happening in medicine in general, and just more conversations about how do we break out of these systems where it's only 5 minutes or 7 minutes with a patient, but really helping that meaningful and sustainable, protocol. And part of it, though, I think comes down to how do we motivate patients, which is full circle to what you're talking about, Alice.
We talk a lot about, the evolution and where we see this going, and how, whether it's yoga, mind body medicine, how it's really finding its place and slowly starting right through practitioners like Alice, right? Really making this accessible, giving it the language that it needs to be received and then practiced. But Alice, in your, in what you've seen, where does the work still need to be done? Right? Where do you feel maybe the most resistance, right? When you work on applying yogic techniques within lifestyle medicine, or even just within lifestyle medicine in general? Whereas, a population, do we really have room for growth and you being able to practice in a way that is really robust?
Yeah, I think the biggest resistance that we face in general is like this, the whole current medical system, right? As Melissa I think mentioned, where appointments are like 10 to 15 minutes long. Um, and there are certain things that have to be covered within that appointment. When you are trying to discuss lifestyle changes and counseling patients and finding ways to motivate patients, it really does take a lot of time, time chatting and building this conversation with a patient. It's really hard to do within a 10 to 15-minute period of time, um, especially, when there are other issues that need to be covered within that appointment time. And then again, getting appointments in with a physician can be a challenge in and of itself. Um, we can go down a whole rabbit hole about this as well, like, insurance coverages and things like that. So there are a lot of physicians within this field um, branching out to other ways of practicing, whether that is through just doing coaching sessions separately versus working in more like a direct primary care type of clinic versus a conventional clinic. So I think that that part is the hardest. Maybe just concentrating on like one little thing at a time at each appointment is helpful. And again, discussing with the patient first about, what is your biggest priority right now. We can just dive into that for this appointment.
It seems, like the issue is it's very systemic, right? It's like you said, we can go down this entire rabbit hole of why it's structured the way it is, why this happens. Have I like that you mentioned the shift, right? That practitioners are finding different ways and maybe different avenues just because of quality of care that they're able to provide, or continuity of care. I'd like to talk a little bit about your experience, right, in the military as a provider, and how you see lifestyle medicine. I know you mentioned a little bit about it being used in the VA, how you see lifestyle medicine being used within the context of military medicine, because personally, we're all military affiliated here. So I love to hear that.
Yes, absolutely. So, even within the active duty military personnel, lifestyle medicine is being infused right now. I know within the Air Force,
Mhm.
There are lifestyle medicine clinics, which I think is termed differently, precision medicine. Um, and, within the American College of Lifestyle Medicine, there is a whole interest group within the military and DoD as well. So we're finding new ways to incorporate lifestyle medicine. I think for within the military, active duty military specifically, lifestyle medicine plays a huge role because not necessarily, soldiers or sailors or airmen have a lot of chronic diseases, but lifestyle medicine can be used to prevent diseases in the future as well as increase their performance in their everyday life. So I think if lifestyle counseling can be infused within clinics, across the active duty military personnel, that would be very, very helpful.
Well, I think that you're starting to see doctors talk more about it. I mean, even in my own experience with primary care, they may not be able to get in it, but they're like, hey, these things are good. And at least, like, I think the little pieces, if providers are just saying, and as I say this, another very contrast experience is coming to my mind too, where I did have a primary care provider saying, hey, by the way, I don't know if you've heard of these things. And I'm like, actually, yes, I love, I'm a yoga teacher, right? And just considering those types of practices for stress reduction. So that was awesome. But then on the other end, I had a provider who said that there's no evidence about lifestyle practices for the specific thing I was going in for. And I just think that when we say things like that to patients, most patients are going to believe that and then not actually look into it. But the truth was, if you just Google, if there's evidence, there was data and literature online, especially on Google Scholar and things like that, about lifestyle practices for this specific thing. So I think that there's that mixed bag happening in clinics. You got providers who are still very much, this is the only way, and if you don't take this treatment or this medication, and that lifestyle medicine's all fluff. Unfortunately, you still have that, but I do believe that as there's more incentives, especially like wellness incentives and insurance incentives that optimize people in their lifestyle, and I think that's remove the business of healthcare to the side for a moment. Naturally, because of the load that we have in our culture, and even with the boomer generation now aging, and the financial load, the responsibility, there's too many patients per provider. So these organic consequences from a very materialized process versus empowering people, right? Like what we've been doing for the 50 years before, it's having to change because we just cannot hold the load of stress related illness anymore. And so I think that's a natural thing that is making the whether it's organizational healthcare such as TRICARE and the military, to these private sectors who they can't keep up with the patient load, so they have to find solutions. So it's like that we're in that weird in between, I feel like, in healthcare right now.
No, I agree. Certainly incorporating lifestyle changes for treating chronic conditions in the long term, you know, saves so much money with the disease burden. In lifestyle medicine, we're not necessarily against any other treatments like medicines or surgeries, of course. That is all, required as well. But I think at the root, since most chronic diseases, lifestyle is a factor in, in the disease as well. So I think incorporating that alongside with the other conventional medical approaches is important. Even within the active duty military personnel, it might not be as big of a, chronic disease burden within that population. However, we know that almost a quarter, like 23% of active duty personnel have symptoms of depression as well. So I think, especially in the military too, with so many changes within their lifestyle happening all the time, whether they're doing field training or moving to another location or deployed, I think lifestyle medicine is helpful because we can personalize it to that individual as well.
Well, I feel that with the data that comes out more and more, whether it is depression or these stress related illnesses on cellular behavior and biology, even if, because I think that a lot of the fear or conversations in medicine, from at least my own experience, is that we're trying to use this in replace of that modern medicine intervention. But let's just use the example of someone receiving chemotherapy. Does it hurt that they listen to a guided meditation simultaneous to receiving chemotherapy, right? Or does it hurt for if someone is on a cardiovascular drug, right? Doing things simultaneous that also helps with lowering blood pressure. I think that the big conversation is, what can we be doing alongside so this medicine helps that medicine and that medicine helps this medicine, and really getting everybody on that same page to that it's collaborative. And also when the patient steps out of your office, now what? Is the patient still accountable and participating in their health, or are they just not doing things it's just the same cycle of problem fix me, problem fix me? So I think that's like a big misunderstanding in healthcare, and I would love to hear your thoughts on that, of as this is all evolving.
No, I absolutely agree. We definitely want lifestyle interventions to go alongside any other treatment that is required, and for patients to make changes in their lifestyle to affect their long-term health in a positive way. Also in lifestyle medicine, one of the pillars we talk about is social connections and positive psychology. So in a way, I think, if when we talk about those kind of things with patients or their spirituality or their relationships with others, I think it's helpful in fostering community growth. As well as planetary health as well. So some of the things we talk about in lifestyle medicine, and we talk about environmental factors as well, and ways to reduce, for example, like our carbon footprint and things like that with changes in our diet. So I think overall, if we think about this being like a collective change, I think lifestyle medicine has a big impact.
So I'm really curious to know if I'm sure patients come to lifestyle medicine their first time around, and it's probably from their perspective a big change. Like you said, if I went in and had a doctor talk to me about my carbon footprint, like, and I would probably be like, what? What are you talking about? And so what has and I'm sure too, people also come to lifestyle medicine because they want that, right? They understand what it is. What do you think is kind of like what you've been met at from a client perspective? Like, is it an adjustment for some people going in for this type of care? Have you noticed like pushback some on certain areas? I'd just be curious to know.
I think a lot of patients, when they come in to seek care from providers, they sometimes want like a quick fix. So really, the patients have to understand what lifestyle medicine is, and come in with a perspective in which they know that change is gradual, even though you might feel some positive effects right away from, making little tiny changes in your daily life, that can certainly cause a big impact. But I think just kind of getting over that, first impression of like, we can't give you, something that's a quick fix.
That makes sense, though. I mean, I think if we look at the way that we've been conditioned to view our health, that kind of fits that box of, okay, quick fix, we're done. But what I love about this, right, is you're like, no, it's, it's again, it's the aspect of the self-agency of it's going to take time and work for the longevity of your health.
What is something that you wish just public health would know, or I guess the public, like for people who are new to this concept, what are some things that you wish they knew or could debunk maybe a little bit around lifestyle medicine?
I would mostly probably just want people to know that it's really simple. The whole concept of lifestyle medicine is really simple and just like really down to the basics, like how you're living your life daily that impacts your longevity, your long-term health, what you eat, how you sleep, how long you sleep, what time you go to bed, what time you wake up. It's just like the simple everyday things actually, over time has a big impact, right? How you manage to stress. Do you overreact? Do you have, certain things that you do to take time to respond to a certain event? Are you do you have a big support group? Do you have strong relationships with others? Do you volunteer? Little things that you do in your daily life that strengthens your personal values, basically creates positive emotions, things that you can be doing on a normal basis. Simple concepts, but huge impact.
I feel like one of the biggest things that people, when you start diving into this, is the permission. Like, it's so simple. Like, what if you just did things that were good to your nervous system, that felt good in your heart, right? And the permission that you can say yes to things you enjoy, but you can also say no to things that feel, dismantling, imbalancing, toxic. Like, the agency, this kind of goes back to what you're saying with helping people reclaim that agency and realize that, if you hate the way the pillows look on your couch and it's bringing, or your environment, you don't like the way your home feels, that you are safe to rearrange it and make new decisions on like the little things we can control. And then the other piece of realizing how we are in relationship with these things, my mindset and my perspective to something, if I can't control the circumstance, what conditions within myself can I renegotiate to make it yummy or to make it sweet? Like sleep hygiene, right? Like if your spouse snores immensely, but you're now going months without, not my, just in case, not my husband, but I'm just going to use this example. And this is, I think about these things, if he did, the permission it doesn't mean that our relationship is bad if I decide to make a nest in the guest room or we negotiate the sleeping structures, because not having sleep due to these conditions, I think sometimes we hold back from just little changes in our lives because we either think we can't, or it's bad, or we just don't feel safe to express our needs, of I don't like how the door looks. Can we change that? Or, or stop wearing shoes in the house, right? You guys are stressing me out. I don't, whatever the thing is, like, I think there's a deeper thing within us about that permission.
Yes, absolutely. And again, it's just kind of slowing down and recognizing, right, that you have the capability to make these changes and you have that innate, capacity to heal whatever you need to heal.
I'd love to hear. So we talk a lot about, how you have taken mind body techniques and how, we integrate them into patient care, but how have they really changed your life as a physician and as a provider? Because it's stressful. It's a lot. I mean, as you say, you were through the thick of it in COVID, and that's when you really leaned in. So it has so much, power within your patients' lives, but how has it really impacted you in what you do and in your work?
Practicing yoga, breathing exercises, meditation, journaling, all these activities have helped me personally through stressful times. And as a physician, learning all these techniques and tools and resources, both through yoga teacher training as well as the lifestyle medicine certification process, has helped me, I feel like, become a better, in a way, I guess more, I guess a physician that can more be more patient with patients, in the clinic room, offer them, more like a calm and serene environment within our encounters. Um, I feel like I've been able to show more empathy towards patients as well. So, in a way, both in my personal life as a mom, as a spouse, as a friend, as well as in my professional life as a clinician, as a physician, it's improved me in so many ways.
And I think that the modeling, right, when you model it in your own life, it's a lot easier to talk about it. And I think that could also be a disconnect in some places where oftentimes we're taught, especially in professions, like, here's what I do, here's what like I'm supposed to do. And I see this a lot even training yoga teachers, is it's like, I gotta know the pose names, I gotta have the checklist. But when we actually allow ourselves to put it on fully and experience these things in our own life, we teach a lot more natural, because we're speaking from a place of truth. We're speaking from a place of understanding, and how much more present we can really be versus trying to sound off the benefits of meditation to somebody who has anxiety. Like, hold on. Right? So it's powerful.
Well, and that's my thought, right? As we're talking about this, and if you have somebody like Alice who has integrated these own practices into her own life, we know, right, that the best teachers model. And so I love that it's, when it comes from you and you model the activity, you model and embody what it means, right? That just means that people are naturally going to be more connected to it and be more open to it.
Yeah, I agree. And if people can share more stories too, right? So maybe I'll share like other successful patient stories with patients or, things like that. It's very empowering and inspiring for patients to hear so many of these stories.
Well, it shows that it's accessible, right? Because I think that in the mainstream, when yoga, for example, is projected as, look at what this pretzel shape I'm in, or if, stress management is only the person in the meditation posture, or happily journaling, right? Well, what if someone struggles with journaling? So, like, finding our ways to really embrace this stuff without it having to be this performative structure. I think that the stories really show it shows real integration of it versus, look what I can do. It's rather, who am I becoming within myself? I have a question really kind of related to what I asked earlier, but what is something you wish yoga teachers would understand about lifestyle medicine, and maybe some different doorways if they're interested in getting involved, whether they're medical or they're not? What are your thoughts on what you wish that they would know?
I would probably tell that lifestyle medicine, again, really concentrates like just like yoga and mind body medicine, how your thoughts and emotions can significantly impact your health behaviors, and that yoga is such a powerful tool in so many ways for your health, not just physical, of course, emotionally, spiritually. If anybody is interested in learning more about the lifestyle medicine certification process, or just want to look up more resources, the best place to go is through the American College of Lifestyle Medicine. So there's a couple pathways where physicians can become certified, and then another pathway for other healthcare professionals to get certified as well. There's wonderful conferences, courses, and resources online. And I wish this is something that was taught during my medical school training years, because I feel like we didn't do enough training in regards to lifestyle interventional changes and treatments. We may have gone maybe a couple hours or few hours of nutrition class, but otherwise, in terms of like mindfulness, techniques or stress reduction, and even learning more about, physical activity that you can do on a daily basis, and how important sleep is, it was really, it should be something that all of us, clinicians should know. and be practicing within our own lifestyles as well. But that's, of course, that's a challenge for all of us. I think nowadays things are changing, which is very, very exciting. I know, for example, like in medical schools, there are like mind body medicine clubs and things like that, even lifestyle medicine clubs. So that's all really exciting to see those kind of changes.
They have issues funding this for the schools. What I've seen is that whether it's the dean of wellness or like these wellness components to residence programs, being able to implement this stuff in, or like you just said, clubs, or going in to guest teach. And I think for yoga teachers, this is part of that volunteerism in a way. Like there are some things that they may not have funding, but until there's efficacy, and I think the journey of this will eventually get there where it can be funded or more things like this implemented. But there is this grassroots volunteerism and advocacy to bring it to education, because there's a lot of change in education is tough when it comes to licensures and state regulations, and so part of that evolution I see, and Alice, I'd love to hear your thoughts on this, is that yoga teachers really have an opportunity to go educate and give their time to drop these seeds of wisdom that eventually may propel more opportunities for teachers in the future. Just education is really a big piece of this era.
Yes, absolutely. Even in, little settings or communities, even within like, medical training, for example, like for the medical residents, having like a wellness, workshop or event, or even within out in the community, having little workshops and just kind of spreading the education is super helpful within clinics too. If funding is available, I know having yoga teachers would be of great benefit.
So for those listening, is there like a specific lifestyle practice or an example that you feel is just such a juicy way to begin with lifestyle medicine within their lives?
I think, depending on, what it is within your lifestyle you want to change the most. But I know one of the most important tool within yoga is your breath. And I feel like with our hectic, busy lives, we don't notice our breath enough. And like just noticing our breath has such a profound impact on our daily lives. So I usually do mention this to a lot of my patients. If even if it's just setting an alarm or like right before going to bed or even upon awakening in the mornings, if you take a couple minutes, 5 minutes of your time to just notice and listen to your breathing, I think that has a long-term, effect throughout your day and positive effects from that. I think it's, even just doing like a 5-minute exercise with somebody within that room, or not even 5 minutes, like a minute or two with a patient in the room, a guided just breathing, noticing how that feels. I think this happens in conferences too, when people demonstrate it, but you can feel the profound effect immediately. And, your nervous system is relaxed, you have a calm mind. And then throughout the day, that can increase, your creativity, your compassion, your, sense of connection to others and things like that. So it's simple, but very profound.
In yoga philosophy, they connect this to the vayus, because the breath is like one breath is the quickest way to get the most usable energy, right? It takes a little longer to digest. Sleep, you got to actually take time to sleep, where with the breath, you get it in one full breath cycle, curates the most usable energy for the body. So it's really interesting. Again, going back to yogic literature, how we have different language for this stuff today, but the realizations and teachings really are timeless. So one last note I want to just say with the agency, one thing that I've learned from the yoga therapy side of the house and diving into a lot of this is that it's something that we train in the nervous system. And one of the gifts that this stuff has, especially the maintenance of mindfulness and yoga in our life, is that it helps our nervous system stay regulated so the prefrontal can be optimized to see more options and listen, right? The vagal tone piece, right? To be able to listen to what the body says. So even if it's brought in just as a tool to help people reclaim that part of themselves, I think, again, for yoga teachers listening, this world, like the lifestyle medicine stuff is something we can so beautifully adjunct, and definitely recommend people looking more into it, paying attention to it. Alice mentioned mind body medicine. There's conferences. And I'm just so grateful, Alice, that you took time to share this with the community, and you're pioneering things that our children and our grandchildren are going to benefit from. And it's just such an honor to be here with you.
Thank you so much for having me here. It was such a joy to be here. And thank you for what you guys are doing by, spreading education and wisdom to others as well.